I'm going to be reacting to my hair transplant journey, the awful first 4 months, an in-depth walkthrough week by week by Simon Knackborn. Let's go.
Hey guys, 4 months ago I had a hair transplant.
It looks like it's a pretty big change, especially 4 months. That hair grew in fast. You can definitely see that he was at least a Norwood 3, probably closer to 4.
If you want to know more about the thought process behind the decision, then you can watch this video that I shot just a week after the procedure.
And when I'm looking here just at his thumbnail, it looks like they did some work into the crown and quite a lot of grafts there into the frontal scalp. Probably in total at least 3,000 grafts went into this case.
But to put it shortly, I am an online guitar teacher slash YouTuber, and therefore I spend hours and hours watching myself on camera, and I just couldn't stand the way my hair looked.
Yeah, so you can see that he still has a preserved frontal forelock, but those frontotemporal areas have really significantly recessed back. I hope that he's also on some medical therapy, as we discuss in most of my videos, but let's see what else he has to say.
Anyway, in this video I want to show you the hair transformation of the first 4 months and show you a little bit what it's been like. The first few days had me looking like a freak.
Yeah, so first few days, I mean, you can see that significant swelling that he has on the forehead and how it's coming down. Some clinics will actually put some like gauze or something there on the low forehead to try to prevent the swelling from going any lower. I find that that doesn't completely work, so the swelling still tends to drop down the face. But then within about a week it goes away, and then of course you're going to be a bit kind of scabby by where the grafts are, and so that's another part of the recovery process.
The strange forehead here was due to the swelling and the headband I was wearing when I got.
So the swelling occurs because of all the local trauma that happens with surgery, and it's the body's way of reacting to the area to try to fix it, to try to heal it. So it sends a lot of inflammatory cells into the area to help. Also, there's a lot of local anesthesia that's used during hair transplant surgery, and so it needs somewhere to go. It takes time for it to fully dissipate, and so those are some of the leading causes of the swelling. So you can see in this picture on the right at 107, they gave him this headband type of thing, and sometimes that could reduce some of the swelling coming down the face, but I think ultimately it just has to run its course, and after about a week, that is pretty much gone.
I got from the clinic. I'm not sure what the headband was good for.
That is exactly my point, that it makes people feel like something extra is being done, but ultimately it doesn't really make a big difference.
I spent the first 48 hours basically just lying still.
What is he drinking here? Let me see. So it looks like he maybe just put some Coca-Cola but into a wine glass. Hopefully he's not actually drinking wine, because in the first few days after surgery, if you drink alcohol, you can thin the blood to a degree and have just some more oozing. So I usually recommend that patients wait for at least 48 hours before resuming alcohol.
Hours basically just lying still and taking the painkillers and antibiotics.
Yeah, so I also prescribe antibiotics for a few days. The first dose is going to be before the transplant starts as a prophylaxis, and then we usually continue it for about 3 days. And of course there's also the pain medication.
I slept sitting up during night.
Yeah, it's really difficult to sleep after these procedures. I like that he's using the neck pillow. I think that's a good idea. We usually don't put any type of wrapping along the back of the head. My concern always with wrapping is that if it were to shift and move, like he has a headband, if he's sleeping and the headband shifts up, it could literally just rub off the grafts on top of his head.
And got around 4 to 5 hours of sleep each night for the first 3 days. After 2 days, I was allowed to remove the bandages. This wasn't a pretty experience.
See, that's my other reasoning for not using a bandage like that, because By the time patients are ready to leave the office, the back actually has dried up significantly from FUE and even FUT. So my thought is that let patients get used to how it looks, how it feels, instead of 48 hours later being sort of shocked by having had something just adherent to the area for that whole time.
Kolla.
She's freaked out. We'll have to obviously blur this for her video, but you can see the blood kind of running down his neck. So again, this is something where 2 days later, most of my patients, the scabs have fallen off and they're nice and dry. But if you have a bandage sitting there pulling off a scab after 48 hours, you could experience this type of bleeding, and that's pretty shocking to the patient and to whoever is in the room with them, helping them with the post-op care.
On day 3, I was allowed to and supposed to start washing my hair carefully every day. I used products that I get from the clinic.
We'll usually give patients a spray to use, the same type of solution that their grafts are bathing in during the surgery. So they'll get it in a spray and they'll be spraying the recipient area. Usually that starts the morning after the surgery, and then that lasts for about 24 hours. And then about 48 hours later, they can take a basin with some warm water and baby shampoo and just do gentle pours over their head.
I was only allowed to touch the head gently with my fingertips.
Yeah, touching like that is okay as long as it's like a patting motion like this instead of a rubbing motion. A rubbing motion or a lathering motion really shouldn't happen until about day 6.
Which my girlfriend helped me with. Since my head was itching really bad during this time, the washing was the highlight of...
See, this type of washing, in my opinion, is a little bit aggressive. I'm sure it worked out fine for him, but I prefer just a bowl and just a gentle pour over the head.
My day.
Martin, det är bara välbehag. Oroa dig inte.
The poor guy.
Oh Lord Jesus.
On day 6, I left my house.
Yeah, truth is, after about 72 hours, I mean, the grafts are fairly anchored in. I'm on the conservative side, so I recommend waiting 3 additional days before a shower. But realistically, after 72 hours, it's going to be difficult to dislodge the grafts.
The very first time and went out in public. This is not recommended such a short time after, but I had to. The Swedish national team was about to play in the Euros, and I really wanted to
He's looking pretty
watch
good, day
the
6.
game with my friends. It felt super awkward being out in public wearing these scabs on my head.
So the scabs, I recommend that patients start to work out of their head, like using a lathering motion with water and shampoo, as I previously said. But you start at day 6, and from day 6 to about day 14, you want to work out most of those crusts. And you don't want to be picking at them, but just daily washes and lathering will usually help quite a bit.
But I pushed through. On day 10, I was allowed to wear a cap and was finally able to...
So the truth is, in my practice, most patients can wear a cap even sooner. You just have to be really careful with putting the cap on and taking the cap off, making sure you don't rub across your grafts. Of course, it's safer to minimize the use of a cap, but as long as it's a loose type of cap, you're not really going to hurt anything by wearing it.
Able to enjoy being outdoors, even though the sun was shining.
Yeah, definitely the hat is useful here to protect against the sun. The sun can cause some healing problems, especially in the first few weeks.
On this day, I was also scheduled to massage the scabs off of my head. This was a process that took about an hour, I think, and once again, I couldn't have done it.
So he's starting this process at day 10. I usually recommend starting it around day 6, but it's all within a couple days of each other.
Without my girlfriend. After this, I pretty much looked like a normal guy with a normally shaved head. Well, except some redness in the transplanted areas, of course.
Yeah, the redness is quite common, and it's going to stay there for at least a few weeks. Sometimes it can even linger for a few months.
I was shocked to actually see hair coming out of my previously bald spots.
Now that hair will likely fall out as we talk about in other videos, but we'll see if that happened with Simon.
19 days after the surgery.
As far as working out after surgery, I usually recommend waiting about 14 days, 10 to 14 days, just because you don't want to be sweating a whole lot and you don't want to be exerting a lot of head pressure.
Some say you should wait a month, but I didn't.
I don't think a month is necessary.
I felt and looked good for about 20 days after the scabs had come off, but about 1 month in, it took a turn for the worse.
Oh my goodness, I wonder what happened.
But generally about 3 to 4 weeks after a hair transplant is when the little shafts that were placed start to fall out. So my guess is that's what he started to experience.
I slowly started losing my new hair.
That is normal. I hope that whichever clinic he went to explained this process to him, because that happens to pretty much everybody. There are some situations, especially with like eyebrow hair transplants, where sometimes people don't actually lose the hair. It just kind of keeps growing. But most of the time, it starts to enter through a hair cycle. So the shafts fall out, and then 4 to 6 months later, the new hair sprouts.
Now this is something that is supposed to happen. It's part of the process. Therefore, I didn't feel too bad about it. Some call it the ugly duckling phase.
Honestly, it looks like not a whole lot happened, so I know there's the coined ugly duckling phase, but the truth is, other than some redness and occasionally like little pimples from folliculitis that occur, it's typically not so bad. It's difficult to wait, because you're waiting for months until the hair starts to grow in, so that's the hardest part.
It wasn't until around the 3-month mark where I started to look good again. Hair had started to grow back out again, and this is when I decided to go get my first haircut after the hair transplant.
Yeah, even waiting for about 3 weeks is safe as far as getting a haircut around the area that was transplanted. For the donor area, I recommend waiting about 4 or 5 days after like an FUE procedure to get a fade, but you don't want them to touch the recipient area, any hair around there, for at least about 3 weeks. But he's now waited just over 3 months to get a full haircut of some of the hairs that have already grown in.
I actually thought I looked really good after the haircut, and this was when I started to feel confident that this whole thing was...
It's nice that overall the hair is really coming in strong already at week 14. I will comment on the hairline. I think that there could be even more regularization of the hairline, but overall I like the shape of it, and I think that it works with his face, and overall definitely adds a nice dimension to the overall aesthetics.
Confident that this whole thing was actually going to work out well for me. For each week after the haircut, I looked better and better. I am now 4 months in, and I am already really happy about the results.
Yeah, he's gotten nice density. He has what looks like some good thickness to his hair, and yeah, the overall results are great. I wonder if he also was put on some medical therapy, because that in combination with the transplant results really can deliver an impactful result.
They say that the first 4 months are the worst and that the best part starts at the 4-month mark. So I'm really excited about the coming 6 months or so.
Yeah, the only type of issue that I see after about 4 months, if, assuming that the growth is good with the grafts, but the only issues would be some pimples and folliculitis that can happen at the recipient area as well as the donor area.
If you have any questions, then hit me up on Instagram. Take care.
Yeah, so here is Simon now. He posted this on July 2nd, so just about a month ago, and he's 1 year now out from his hair transplant. And overall, I think the results look great. I mean, look at that density compared to where he started. So that's an impressive result. Overall, nicely done. And it looks like he had this surgery done in Sweden. So, there are amazing hair transplant surgeons all around the world. Just know where you're going, know your surgeon, have a good sense that they'll take good care of you. But the truth is, there are great places all around the world, and it looks like Simon had a great result. If you enjoyed this video, check out our reaction video to Brett Maverick's hair transplant in Turkey.